Hi everyone, it is Olivia from the One Community Health Communications team, and I am here with Dr. Tidwell. How are you, Dr. Tidwell?
I'm good. Nice to see you.
Good, nice to see you as well. So, March is Colorectal Cancer Awareness Month, and I know that there's just been some questions circulating, and we kind of just want to ask you a few frequently asked questions and just have a short conversation about colorectal health.
All right.
So, my first question is, what is colorectal cancer?
So, colorectal cancer is actually a pretty common cancer that is in part of your large intestine called your colon, where your food is processed. It often doesn't start out as cancer. A lot of times, it actually starts out as a growth called a polyp that then, over many years, can develop into a cancer.
Okay, that's very interesting to know. Thank you for that. And so, how do you prevent colorectal cancer?
The biggest prevention strategy is actually lifestyle. So,
Okay.
staying active, maintaining a healthy weight, avoiding things like tobacco and alcohol, avoiding highly processed foods and red meats are all thought to decrease our risk of colon cancer. The other thing that you can do, though, is screen for early growths in the colon that can be taken out before they ever become cancer. So, kind of a two-pronged approach, partially through lifestyle and then partially through screening that we offer here.
Okay, that actually goes into my next question. And so, how does a clinician test for colorectal cancer?
So, there's a couple different options. So, we have stool-based testing. So these are home stool kits that you can do. There's different ones available, but they're usually done between every 1 to 3 years.
Okay.
And they look for signs in the stool of growth of a polyp. So they're not actually looking for blood like some older tests, but they're looking for more advanced signs that can tell us that there's something growing in there. If one of those tests come back positive, then we recommend getting a colonoscopy.
Okay.
A colonoscopy can actually itself be used as a screening test. You can skip straight to the colonoscopy if you want to. A colonoscopy is a test that we do under anesthesia when you're asleep. It involves using a camera on a kind of flexible line to look into the colon
Okay.
for any growths. The nice thing about that is because we're looking in the colon, we're then able to remove anything right then that we think could be problematic.
Yeah.
So we can get kind of precancerous growths out right in that moment, as well as, of course, detect any cancer.
Yeah, that is really cool. I didn't know that you guys were able to go in and remove them right then and there. So that's really interesting
Yeah.
to know. So at what age should you start screening? Would you recommend screening for everybody? Is there a certain age that's recommended you should start?
So nationally, it's recommended to start at age 45 if you don't have any family history of colon cancer.
Okay.
If you do have a first degree, which means immediate family member, so parents, sibling, child, I think mostly apply to parents in this case, but you would want to start screening 10 years before the age that that person develops a cancer.
Okay, good to know. Thank you. What are some additional tips that you think people should know about colorectal cancer?
I think the important thing is that we are seeing it in younger people now. So sometimes we are seeing cases more and more in people that are younger than 45. And I think the big message would be to not ignore symptoms. So any sort of symptoms like blood in the stool, rectal bleeding, a new change in bowel habits, weight loss. Those are all things that I would highly discuss with their care team so they can look into it farther and not just ignore.
Okay, those are good tips. Thank you. So, my last question is, what advice would you give someone who feels nervous about colorectal cancer screening?
Yeah. I would say that your clinicians talk about it all the time. Like we are having these conversations multiple times a day, every day. We do not feel weird about it at all.
Yeah.
And we want to talk about it with you, and we want you to tell us if something's going on. So it can be an uncomfortable thing to talk about. But just know that we don't feel weird about it at all, and we really would like to know if you're having symptoms.
Okay, good to know. Thank you. Is there anything else that you think we should know during Colorectal Cancer Awareness Month?
Just that, the best screening is any sort of screening. So picking any of those tests is a really good idea.
Okay, perfect. Thank you so much. I hope that you guys enjoyed. We will see you guys next time. Bye.